All right, good afternoon, everyone, and welcome to our May Teach Educational Rounds. Here with us today, we have Dr. Laurie Zawertailo and Dr. Peter Selby, who will be presenting on health effects of e-cigarette use, Project Vector update. And we'll begin today with CAMH's land acknowledgement. CAMH is situated on lands that have been occupied by First Nations for millennia. Lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crowns as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase, Treaty Number 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. And CAMH is committed to reconciliation. We will honor the land through programs in places that reflect and respect its heritage. We will embrace healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. So now I invite everyone to share in the chat which traditional territory you are joining us from today. And if you are unsure, I'll just put a link in the chat here and you can use that to find out. And people are also welcome to share something you are doing to learn or improve your commitment to reconciliation. And in the meantime, I'll just share my own personal land acknowledgement. My name is Rachel. I am a second-generation Canadian located on the lands of the Mississaugas of the Credit, which is covered by Toronto Purchase, Treaty 13. I continue to listen and learn about the stories and cultures of various Indigenous communities and ensure that their voices are heard. So I can see people are sharing in the chat. Everyone is welcome to continue to do so. In the meantime, I'm just gonna keep going with some more items. But yeah, feel free to keep sharing. So this is a reminder that if anyone is interested in receiving a letter of completion for this Teach Educational Rounds, just to make sure you completed the pre-learning assessment and registration for this presentation, as well just ensure that you have signed into this webinar using your first name and last name. And that following the webinar, you complete the evaluation and post-learning assessment, which will be sent to everyone by end of day today, along with a copy of today's slides and a recording. So now a bit more information on our presenters today. So first we have Dr. Laurie Zawertailo. Dr. Zawertailo obtained her PhD in pharmacology at the University of Toronto in 2002. Dr. Zawertailo's research interests are in the areas of behavioral and neurobiological aspects of tobacco dependence and treatment, especially in individuals with comorbid depression or alcohol use disorders, which are subpopulations who have an especially high prevalence of tobacco dependence and tobacco-related morbidity and mortality. And here are her disclosures. I'll give everyone a minute just to read through those. And our next presenter is Dr. Peter Selby. Dr. Selby's research focuses on innovative methods to understand and treat addictive behaviors and their comorbidities. He uses technology to combine clinical medicine and public health methods to scale up and test health interventions. His cohort of more than 400,000 treated smokers in Ontario is an example. He has received grant funding totaling over $100 million from CIHR, NIH, and Ministry of Health, and has published more than 150 peer-reviewed publications. He has published six books, is the author of 31 book chapters and 38 research reports prepared for the government. He is also mentors fellows in addiction medicine and addiction psychiatry, junior investigators, and medical students. The use of innovative methods to communicate messages makes Dr. Selby a sought-after speaker for various topics, including addictive disorders, motivational interviewing, and health behavior change at individual and system levels. And here are Dr. Selby's disclosures. I'll give everyone a moment just to read through those as well. And another note that the content of I'll Teach educational rounds are based on evidence-based guidelines from the following sources. And nonetheless, the verbal presentation and any discussion only represent general principles and don't remove the need for clinical assessment or treatment plans by healthcare professionals. And as it is World No Tobacco Day, we just wanted to take a moment to recognize that and let everyone know we will be sharing some tweets throughout the day with resources. So I encourage everyone to check out Intrepid Labs Twitter at PS Quit Smoking throughout the day for more information. And just before we get started, I'll just make a quick note that we will have a Q&A period at the end of the presentation. So if anyone has any content-related questions, make note of those, and we'll have time set aside at the end for Dr. Selby and Dr. Zawertailo to answer them. And with that, I will pass it on to our presenters and let them take it away.
Great. Thanks very much, Rachel, and happy World No Tobacco Day, everybody. I'm joining from Ottawa, the first World No Tobacco Day forum that they're hoping will be an annual event. So happy to be spending my lunch talking to you about a project that we did last summer, actually almost a year ago exactly, June 1st and 2nd of last year, called Vector. And do I page down?
There will be the arrows at the top next to the slide number.
Got it. Okay, thanks, Rachel. So the learning objectives for today are to, we're going to describe the methodology that we used for the Vector project. Vector, and if you've been to any of our webinars before, you know we're fond of acronyms, stands for Vaping and Electronic Cigarette Toxicity Overview and Recommendations. So the purpose of this project was to investigate the literature to come up with recommendations and considerations for people who currently use or are thinking of using e-cigarettes, and for the healthcare providers that are treating them. And so the other learning objective is to discuss at the Q&A how these recommendations and resources can be applied to your practice. So Peter, do you want to talk about the case study introduction, or can I introduce it and then you'll discuss it later?
I think because we're going to have to pass it on, just why don't you do it? It may become problematic. Sure. So why don't you go ahead?
Okay. This is the case study that we're going to discuss at the end of the presentation. So this is Claire. She's a 50-year-old who identifies as a woman. She is postmenopausal. She currently uses combustible tobacco cigarettes and has tried e-cigarettes in the past. She's motivated to quit all nicotine, but she's not sure where to start. She has made multiple quit attempts in the past, but has always relapsed within 2 months. So her longest quit has been for 2 months. She's unfamiliar with the health effects associated with e-cigarette use, but thinks vaping is relatively harmless. So we know that vaping is highly prevalent in Canada, and of all Canadians of all ages, 6% have vaped in the last 30 days. And of this 6%, almost 80% vape every day. And within the youth in this group, 69% of them have actually never tried tobacco, so they've just gone straight to vaping. They're not using vaping as harm reduction or smoking cessation, they're just vaping. And I guess the assumption is that they're vaping nicotine. So within 15 to 19-year-olds, 14% have vaped in the last 30 days, and 31% say that they vape to reduce stress. And again, in young adults, 20% have reported vaping in the last 30 days. And then the prevalence of vaping actually goes down in adults 25 and older. So only 10% of Canadian adults 25 and older have reported vaping in the last 30 days. But I think what we need to remember, especially in World No Tobacco Day, is that the prevalence of smoking, especially amongst 15 to 19-year-olds, is at an all-time low. It's 3% or less, according to the last surveys. And so while we're seeing an uptick in vaping, we are seeing very, very low levels of smoking. And I think we need to be reminded of that success story. So moving on. So the project aim is to assess the health outcomes associated with e-cigarette use and to kind of collate all of the literature, of which is varied and becoming more and more extensive. And we did this using a combination of getting the highest quality evidence, discussing it with subject matter experts and with people with lived experience at a 2-day meeting. And we evaluated the health impacts of e-cigarette use for populations who use and who do not use combusted tobacco. And then our aim is to share these results widely, starting with this webinar, to help guide both stakeholders and Canadians in their decision-making process around vaping. So there is an abundance of high-quality evidence, and we try to translate that into actionable recommendations for healthcare providers and for the general public. And this is how this is our approach to create order out of chaos. And I think if you ever try to delve into the literature on your own to try and discern what the exact health effects of e-cigarettes are, you know that it's pretty chaotic. So this was kind of the timeline. So prior to the 2-day meeting that happened in the beginning of June last year, we did an extensive literature search. We collated all of that literature, organized it into tables. We invited our subject matter experts from around the world and sought out patients and participants with lived experience and expertise. After the 2-day meeting, we shared the post-meeting results. We also did an updated literature search late last year. We developed resources. We did some usability testing with those resources with both healthcare providers and members of the general public and our patients with lived and living experience. And we have been distributing those resources since March, pretty much. And we are currently working on a publication, a peer-reviewed publication of this process. So in addition to the actual recommendations and guidance, we actually produced a number of knowledge products as well. And these products will be going through, but they are both for providers and for the general public. And they're quite varied, and I think they're quite excellent. So the first step, evaluation of the evidence. So as I said, we collated all of the evidence on 4 specific potential health effects of e-cigarettes. And we invited 23 subject matter experts from the US, the UK, Australia, New Zealand, and it was a hybrid meeting. So this is a picture of everyone who attended in person. We also had people on WebEx. And we also had advisory group members who were our patients with lived and living experience and expertise. So the tasks, roles and responsibilities of the panel members were to review the evidence tables prior to the meeting. Our participants with lived experience were given evidence table summaries. And then we assigned topic leads to summarize and present the evidence at the meeting. And then we discussed and developed recommendations based on this evidence. And then we participated in blind voting on the language of those recommendations. The participants with lived and living experience also participated in the blind voting and in the discussion process. And they co-developed and reviewed and tested our resources. So I think I've gone through most of this. So our recommendations that were drafted were used grade criteria, which is a standard standardized criteria for this type of work. You know, if there was no consensus on the first vote, then we reworded and we revoted. And then the final recommendation was then included in the guidance resource. So we used grade, which is outlined here. I won't go through each step. But if we decided that the evidence was of low quality, which is defined as further research, is likely to have an important impact on our confidence in the estimate of effect and is likely to change that estimate, then we omitted that recommendation. And where panel members' votes were split on quality, and we couldn't reach full consensus, we combined those quality levels. So you might see some that say moderate to high or low moderate, and that's why. So we drafted and voted on 11 recommendations across 4 health outcomes. So those 4 health outcomes that we focused on were cancer risk, respiratory health effects, cardiovascular health effects, and nicotine dependence. We generated summary and consideration statements that supplemented these recommendations to provide more context, and they are outlined in the main guidance document. And then we developed the guidance resource through an iterative kind of online process with the SMEs, because we dispersed after the 2-day meeting. And then we developed 5 supplementary knowledge products that we'll go through. And these were developed through brainstorming, usability testing. So our recommendations. So our recommendations regarding cancer risk. Our first recommendation is for people who do not smoke, they should not use e-cigarettes in order to avoid exposure to potential cancer-causing chemicals. And the quality of the evidence we found to be moderate to high, and the strength of our recommendation is strong. So all of these tables will look the same, where we'll have the recommendation and then the quality of the evidence as assessed by the panel, and then the strength of the recommendation. And then we also said that people who use e-cigarettes, whether it's to quit smoking or not, is that they should avoid long-term use of e-cigarettes in order to reduce exposure to cancer-causing chemicals. So, you know, once the risk of relapse back to combusted tobacco is considered low, then people should consider quitting e-cigarettes as well. With respect to respiratory health, again, people who do not smoke should not use e-cigarettes because there are effects on respiratory health. And the evidence, the quality of that evidence is high and the recommendation is strong. Especially in tobacco users with pre-existing respiratory diseases, e-cigarettes are certainly better for their lung health than continuing to smoke. But they should switch to e-cigarettes only if they've tried other evidence-based methods for quitting smoking and have been unsuccessful. And people who use e-cigarettes should, again, avoid the long-term use in order to prevent this exposure to respiratory toxicants. And same with cardiovascular health. So again, people who don't smoke should not use nicotine-containing e-cigarettes. There are cardiovascular toxicants and there are adverse effects on the cardiovascular system. But in tobacco users, if they tried other methods to quit and have been unable or unwilling to quit using these other evidence-based methods, they should switch to e-cigarettes in order to reduce, because even though e-cigarettes have these potential harms, it's far, far less than combusted tobacco. So with respect to nicotine dependence, so the evidence was high to moderate that using e-cigarettes may lead to nicotine dependence. And so those who don't smoke should not use nicotine-containing e-cigarettes because of this risk of developing dependence. In tobacco users, however, it is still a potentially recommended method of quitting in order to reduce their overall dependence on nicotine. Although that was a moderate to low, and there really was no consensus on that statement. Again, the evidence is kind of equivocal. Some research says that nicotine dependence from e-cigarettes is lower than that from tobacco. Others, it's the opposite. So we could not reach consensus on that statement. Okay, so of course, you know, when it comes to e-cigarettes, we can't ignore the group that uses them most, and that's adolescents and young adults. But there again is little evidence of specific health effects of e-cigarettes on the specific population. And so we couldn't derive any strong recommendations with a high quality of evidence. And we know that there may be different things that we need to focus on with respect to adolescents and health effects of e-cigarettes, such as you know, potential adverse effects on cognition, brain development, etc. So the next part is applying these recommendations and resources in your clinical practice. So we developed these healthcare provider-facing resources, and then other resources that could be used by both healthcare providers and by just the general public, or people who are already vaping or smoking and just need information. So we have this comprehensive overview of the health impacts of e-cigarette use in these four main areas of cancer, cardiovascular health, respiratory health, and nicotine dependence. And this provides the reference list and our details on the methodology, etc. There's the QR code if you want to scan it to get the resource. There's general considerations related to use of tobacco and nicotine and e-cigarettes specifically. And then there's recommendations and additional considerations just to provide more context around those recommendations. Hopefully people have had time to scan that, but I think there's a QR code at the end as well. And then there's just a summary, a one-page summary of the recommendations that we developed as well, just as a quick reference guide. And then we have this kind of decision map that can be used by healthcare providers or by individuals or by healthcare providers as they're talking with their patients. Pathways to a Smoke-Free Life, and it just goes through a decision-making tool to just kind of think about, you know, in people who want to quit smoking, what they've already tried, what successes and failures they've experienced with previous quit attempts, and then what they can maybe try next. And then we have this infographic that is useful again for both healthcare providers and individuals. It just visually depicts how vaping affects the individual, and so we cover brain health, respiratory and cardiovascular health, pregnancy. So it's just again a nice brief one-page resource that you can hand out to your patients. And then we have frequently asked questions about vaping. And again, this is a one page, just very succinct information. And then with a QR code where people can actually learn more. But it's a good start with just very basic information for your patients. So again, the two, the main question that I'm sure you all get asked is it safe? And so this is just a summary of the kind of overall assessment of safety of e-cigarettes. And then, of course, you have patients or clients that do currently vape, and this resource might be helpful for them in order to get them to think about how to reduce their harm from vaping. And dual use, vaping and smoking together, is known to be not a good thing to do. So the first kind of tip is to quit smoking altogether and to just vape. To use, regulated products, not to tamper with those products, and to store their devices and their e-liquids safely. Can you see that QR code? It seems to have. There. Okay. So now we have the case study application. So I think you're up, Peter.
Thanks, Laurie, for that lovely summary of the work. It sounds a lot, but we were very pleased to work with our partners to get at O2 to get this the data tables done and then bring it to the larger group. And so if I can I get control to the slides yet, or?
Yes, you will have control now.
Okay. Let me see if I can move slides. There we go. Okay, so let's get back to the case. And the case is an essential one. I think we'll just think about it. We have a 50-year-old who is obviously, typically somebody when they're coming 50, they've probably started in their adolescence. So you're getting close to, getting close to 35 to 40 years of smoking, depending on how young they were when they started. And they're accruing the harms from smoke. As we know, most people get harm from the combustion and the products of smoke, the 7,000 chemicals, 60 carcinogens, not so much from the nicotine itself. And so here's somebody who's got that. In a women are way more susceptible, have a harder time quitting. Postmenopausal, which means all the benefits of having estrogen are rapidly lost. And in fact, smoking just removes that. And you have somebody now who's got in between, using combustible tobacco, tried e-cigarettes, didn't like them, has stopped, maybe wants to think about it, wants to quit all nicotine, wants to just give everything up, but has made multiple quit attempts in the past. And, sometimes people have made 10, 20, 30 quit attempts, but keeps relapsing to smoking within 2 months of that attempt, going back to smoking. And most people, as you know, are unfamiliar with the health effects with e-cigarettes and thinks vaping is harmless, or you can have people who think vaping is really completely harmful and won't use it at all. So you have both these types of people who come, and it's really important for us to use this evidence that we've now created to be able to help people make an informed choice. So the question is, how can you support Claire? You know, take a look at which resources would you use, what resources would you use for Claire, and you can look at that and see what language also that you could have. And feel free to start typing into the chat. We'll be paying attention to it as well. If you want to have anything, say things that go. So we will put the QR codes again. And when you can get that, so let's put a link into the website in the chat if you don't mind. And here we have questions. So yes, absolutely. We can talk about this as we go along. And let's just go back to supporting Claire. So yeah. And then that's the link to all the resources. And it's really discussing where they are, what the difficulties exactly, as you're saying. And yes, we will come to, you can use this also for some people who, people who aren't dual users and are wanting to quit vaping. Of course, we have a vaping guidance resource already that has been created and is on our website of how to help people who vape, who want to quit vaping. And that's a lot of times, those are people who've never smoked. So we get that as well. So thinking as we move along with this, we go back to the vaping option and the little guidance that we have. So they've tried quitting many times using best available methods, returns to smoking within 2 months. We have a pathways to a smoke-free life decision map. You can see that, if somebody hasn't tried any, clearly you're going to try this. You're going to add counseling. There's NRT, there's varenicline and bupropion, the cytosine now is also available. And of course, if you've tried all these things, or the person is not willing to try them either alone or in combination, then is a vape or e-cigarette good? And one of the things that you can see, it's very clear, switch completely to vaping, not a dual use. And so we really want to make sure that they are aware that they have tried evidence-based treatment and tried them long enough. I mean, often people say, well, I tried NRT. Well, they only tried, gum for 1 week, or they used a patch, but they used a very low dose of patch and only used it for 2 days or something like that. So it's really important to know what they've used and if they've used it properly. Yeah, and the guidance is our vaping guidance resources also on our website. It's there. Moving on. So let's say that the discussion is, for the purposes of this talk, is yes, we've gone through the evidence-based treatments, the other approved treatments, and this is one where we've talked about with her, and so that's the place where you'll end up talking to her. So again, in somebody who thinks this is harmless, regardless, we have to make sure that they understand it. If they are currently smoking, vaping is significantly less harmful than smoking commercial tobacco products. So that's based on current evidence, and summarize that overall, yes, vaping is significantly less harmful in terms of exposures. Low amounts of toxic and cancer-causing chemicals when they vape. But this doesn't necessarily mean that vaping is completely safe, as it can still cause harm to a person's health. Depending on what's in it, there are some chemicals that are low dose, that we don't really know what long-term exposure to them is, especially, they're not chemicals that necessarily even show up in tobacco. So, I don't think you can say 100% safe, but nothing is 100% safe. This is a relative risk. So if somebody is smoking and they can't or won't quit with evidence-based treatment, then certainly their exposure to chemicals will be load will be a lot lower if they do switch. So it may seem like you're giving a mixed message, but this is the honest message. The other question that the person may have is, can vaping help me quit smoking? So we always reiterate, we have all the options available. Cytosine medication, nicotine replacement, clearly combination nicotine replacement and varenicline are equivalent in their abilities to quit, and there's some less evidence, but bupropion and varenicline can help. I'm sorry about that typo there. It should be bupropion, not an. These options are especially effective when combined with counseling. And so that's the other thing that, people should try to take counseling, but don't withhold pharmacotherapy if they're not willing to engage in counseling. Brief advice and just supportive counseling by you as a provider is often sufficient. So definitely trying those things and then switching to vaping really can help them, increases their chance of staying smoke-free. And that's the guideline. The evidence suggests that that's true. And compared to cigarettes, vaping exposes you to low amounts of toxic and cancer-causing chemicals. But again, it doesn't mean it is completely safe. So we've given people language there that they can use if they're not comfortable with, articulating it. If using e-cigarettes to quit, she has to switch completely. That is often what happens is people go dual use. They'll say, I'll smoke when I can, and I'll use e-cigarettes when I can't smoke. And so that way I'm having the best of both. Those things are not recommended, and you may land up with higher exposure of nicotine that way. So really ask them, to switch completely. And then if they have switched completely, then evaluate the risk of relapse to combustible tobacco should they start tapering. And so I tend to have people taper really slowly. That's a clinical mind, it's not in the guideline, but generally that's what we have to do is, if relapse is not a concern, recommend avoiding long-term use of e-cigarettes. But why you want to avoid long-term use is you want to avoid a full dependence on e-cigarettes and reduce the exposure to harmful and toxic chemicals in the long term, and obviously improve heart and lung health. So those are the kinds of things that we want to make sure that after a certain point in time, if it's past its utility in helping the person give up combustible cigarettes, then as long as they're not going to relapse back to them, a discussion should be had about reducing or eliminating e-cigarettes as well. We do provide information on vaping-related harms, and this infographic on the right is a general one, so it can be used for telling young people about effects on brain development, or it can be used in women who are pregnant about effects on the fetus. But for the most part, in Claire's case, we're going to be talking about effects on the lung and heart, and they're not aware of it. So we can share that with her, and then really have this understanding that, yes, when you are vaping, it can lead to lung and mouth irritation. And again, it may trigger people who have asthma or COPD, so they've got to be really careful when they're doing the switch over that they're not making themselves worse. And theoretically, you can see some of these acute effects of nicotine that occur when people vape, and you can get that impact that you would see with somebody who's smoking. But if they're switching over, it'll be the same thing. The other part is, what are the ways, if you're going to use a vaping device to quit smoking? Remember, they're not approved for cessation in Canada, so there's no health claim. These are all available legally with up to 20 milligrams per mil of nicotine. But make sure that they understand that they quit smoking. Do not use unlabeled or old products. Prevent the battery and fire explosions in how they're getting in. Try not to adjust the heat aspects of it, or the temperature that it goes up to, and obviously prevent themselves from getting nicotine sick or nicotine intoxication, because with vaping you have no idea how much you're getting. So be very mindful on how much nicotine you're puffing back, because you could land up with nicotine toxicity with nausea, vomiting, lightheadedness, low blood pressure, etc. So we often talk to people is like, make sure you have discrete vaping episodes rather than grazing through the day. and also take care of reusable devices because they need cleaning, etc. Store them devices and liquids safely, and avoid or limit long-term use. So those are some of the things in terms of making sure we pay attention to the harm reduction aspects. So I'm just going to stop for a minute because I see a comment by Cindy D'Souza. As a clinician who refers clients to inpatient addiction treatment, vaping is still not permitted at most programs. Either they are smoke and vape free or only allow cigarette smoking during breaks. We have found this due to cigarettes being approved, e-cigarettes being approved by healthcare. Any chance vaping may be approved by in the future? When in residential treatment programs, of course. Yeah, so I guess with vaping being that, I think it really depends on what the purpose of that addiction program is, a residential program, and so there is currently, prior to the advent of e-cigarettes, to be tobacco-free and use, approved nicotine replacement as a way to manage acute withdrawals. Because of the long-acting nature, and help people be comfortable and experience cessation in a controlled setting. But only for a short term, because that is. But again, we don't know if there's any products that have been submitted to Health Canada for approval yet. So don't know if we're going to get that anytime soon. But these are certain things that we have to think about as to whether the category of this is interfering, and how much of it has to do with education and helping people understand that while they're inpatient treatments for other addictions, that it is really managing nicotine withdrawal, and that decision in no way should affect their long-term decision to quit smoking. So I hope that answers your question, Cindy. Thank you for that. So what else can we do to support Claire? Any other ideas of what you could do? We've said here are the resources. Yes, and exactly. And Derek says something really true. In this stage of legalization of cannabis, THC vapes may also be mixed. And in fact, in the U.S., there was some problems with lung disease caused by vaping illicitly produced THC, and so that is the issue. Provide psychoeducational support, behavioral support. We talk about the milestones. About first milestone is doing 100% switch over, going a day, going a week, being comfortable, being not in withdrawal, not having toxicity, and really making sure that they're keeping track of the amount of nicotine they're using. Examine the triggers, and then really, once they're stable and have made the switch over, reassessing periodically with them at their around where they're coming off vape is where they're willing to go. So as I said, we're just putting this up here. The resources are all on that page, and you can also you can see them. You can either scan it from your phone right now, or Rachel's put it into the chat. So that's just an overview. We wanted to make sure you had the overview of all this work and Project Vector, where it's at, and the recommendations. And so and the question is, has it been tested with teens? No. I think that's one of the things that we would like to take it to the next level, because with teens, you're really wanting to, one, prevent young people from taking it up at all, and then if they're taking it up, understand what is going to be required to help them stop, because the observations that we're getting, at least from local data and Canadian data, is that the young person who is taking up vaping in a way that they're getting addicted to it essentially is predicting that they're also going to be using cannabis, drinking alcohol, they may have other mental health conditions. So any vaping cessation program with teens, especially at the tertiary end side of things, after they've established heavy dependence and daily use patterns of it and cravings and what have you, is to be able to it will be different. So I think if we're going forward with these guidance for young people, it's going to be very dependent on not just adapting this, but really thinking about whether for really with teens. Youth and young adults is one thing, but when you're talking about a 12-year-old or a 14-year-old, or a 13 or 15-year-old, maybe slightly different. So I think I don't think we have the guidance yet. I mean, most people will say, look, for that age group, shouldn't be using anything. But the clinical aspects are is that at least in our clinic, the Andrea tertiary care, our adolescent medicine physician, their referrals are very complex. Young people who've got vaping and cannabis and alcohol and other drugs and depression and anxiety and self-harm behaviors, etc. Okay, so do we want to just drop the share slide so we can get people just see the chat better? I was just hoping to see the chat much better. I don't know if
Oh, I can read them out if you want.
Okay.
I see another question. Someone wanted to know your thoughts on someone thinking switching to less nicotine content. Is it harm reduction? Chemicals are still present. Nicotine is low, but there's still chemical exposure.
Yeah. So Laurie, I mean, feel free to jump in as well, but there have been these studies of very low nicotine cigarettes in the US, and yes, they can make a difference. The concerns are obviously, when you have higher cigarettes out there, yeah, they can go up and compensate with other forms of nicotine. Or later you meant vaping, not cigarettes. I mean, less nicotine content is, I think that's the issue. If somebody is dependent and you lower the nicotine content, do they compensate by just taking more in? So, it's always that issue of quantity, frequency, and the concentration of what that liquid is. So, when we are tapering people from the 20 milligram per mil down, and they're using one of those, cartridges every couple of days, we're really working with them to take the same concentration and stretch it over a longer period of time. But Laurie, do you want to comment on that one as well?
Yeah, I would agree. It's an excellent point because, similar to cigarettes, it's not the nicotine that's causing the harm, right? It's all the other, food grade flavorants. But when you inhale them and you inhale a lot of them, what are they doing? And the other kind of the little bits of metal that might get in, et cetera, et cetera. So you're right, just reducing the nicotine content, but continuing to vape regularly is not necessarily harm reduction. So yeah, I think your approach to just use the same nicotine concentration, but to get them to reduce their use throughout the day. And I think, it's very similar to what you would counsel people with respect to tobacco use, right? Like, don't vape indoors. Don't vape in your car. Just all of these little behavioral things where you start to disentangle the use of your vapes with your everyday life.
Yeah. In terms of the question that Richard has, recommendation for a pregnant smoker, I think we had the committee and we did not agree that it should be done in a pregnant woman, because the issues with pregnancy is that again, it's the other things that are in an e-cigarette that gets us a little anxious about it. But so in somebody who's pregnant and smoking, is it better? I think there's a UK study trying to do that, but it didn't make its way into the guidelines in terms of as a recommendation. With appropriate warnings, yes. But again, is it Are they mid-trimester? I suppose that's fine because they've already tried behavioral and nicotine. And typically, when somebody is not quitting at that time, I'm also screening for other things like depression and anxiety and all those things that may require treatment, which might then help her quit. So I don't know if that answers your question, but that's roughly where we're at with that.
Okay, thank you. Did anyone else have any other questions? I'm not sure if this was answered, but I think a while back, someone wanted to know if the resource included information about supporting a non-tobacco user who vapes and wants to stop vaping.
Yeah, I mean, we have that in, oops, I'm just trying to get to the page. I think you put it out there, right? We have a vaping guidance, and that could be for people who've never been never smokers as well. I think just roughly in that situation, it's really, if somebody's been a never smoker, even if they are vaping, it's sometimes, especially young people, you're not sure if they're using with nicotine, without nicotine, whether they actually physically dependent on it. And so that's really what we're trying to sort out, because if they're not physically dependent on it and you give them nicotine replacement like a patch, it can be quite toxic. There was some ideas that, oh, we could calculate what the dose of nicotine should be based on how much they're vaping, but the downside is this. It's the vape is what is there, that 20 milligram per mil is what's in the liquid. What we don't know is how much is delivered to the lung and how much of it is then absorbed. And so we have no idea of how much is actually going into the person. So they may not have the level of tolerance that you think they have. And so pretty much our approach, and it has always been this way, is to see if you can, if you're going to use nicotine replacement, then use a short-acting nicotine replacement. If you want to get away from nicotine because they were never nicotine dependent to begin with, then is bupropion or varenicline a better option? All of this is off-label, as you know. We're not talking about it. There's no studies and trials that can show that, or an official indication for this. But I think that's what it is. Yeah.
If I could just jump in, Peter, there have been actually 3 recent trials now for vaping cessation, 2 with varenicline, I think, and 1 with nicotine replacement therapy. And they all show pretty much that they're small studies, pilot studies, but pretty much the same quit outcomes at end of treatment in 6 months as you see with cigarettes. So potential there for a growing evidence base around using both NRT and varenicline for vaping cessation.
Yeah. But it hasn't made it onto the label yet. So I think, yeah, officially you can, but there's some, emerging.
Yeah, no, off-label for sure.
Say again? Yeah, it's not on the label.
It's definitely off-label. Yeah.
Yeah, yeah. So if you go to the full guidance around the thing, there's under section 12, it's called fetal health. And you'll see how that played out in the recommendations and in the discussions we had. And we, one of the things I think is we do need better evidence for it. And I'll just read out very quickly. We said e-cigarettes are currently considered to be a harm reducing during pregnancy compared to combustible tobacco use, but any nicotine use increases the risk of negative effects to the fetus. Fetal exposure to nicotine in animal studies suggest a negative effect on neurobiology, cardiovascular and respiratory systems, cognition, renal development, and birth weight. And limited evidence on humans suggests that e-cigarettes during pregnancy has little effect on birth weight. E-cigarette use during pregnancy is a last resort for those unable or unwilling to use nicotine replacement or medications for smoking. So I guess, Richard, to answer your question, based on the guidance document, yes, and that, yeah, you would in that situation, but I would be really careful about this as we're doing that. Yeah, and as Natalia said, there are people who are smoking, low-level smokers who switch to vaping, and then they become constant grazers and find it difficult. So that is really important that people understand that if they're switching to vaping, it's not about escalating their use of nicotine, but minimizing it. And that's, as Laurie said, we should tell people, look, vape like you would in the places where you would smoke. Don't do it all day long. Go outside, have a small session. You only, the difference is people don't know when they're done. So say have a few puffs till you feel satisfied and not in withdrawal, and then, stop. Um, and so should it be done with professional support? I think it should be an informed support. Now, whether it's professional or not, but it should be informed. And the question is, how do you inform everybody? Because it's commercially available. People are going to walk into a vape shop and buy it. So, and Richard, you asked whether these guidelines could be regularly updated as more evidence about the health impacts of e-cigarettes use. That has always been our dream. If we can get funding from Health Canada to continue to do this, then yes, we will certainly try to do this as it becomes available. But it is our hope that we can keep doing this more regularly, because I think it is an emerging and evolving level of science. And then Denise asked, I've seen a video of Dr. Bogby who said that nicotine treats ADHD. What is your thoughts on this? It's a tough one, right? Because nicotine does improve attention, but in somebody who's gets physically dependent on nicotine and you suddenly cut it off, one of the signs of nicotine withdrawal is difficulty with concentration and attention. So, and it'll disappear if they take nicotine. So often you don't know if you're just treating a withdrawal termination effect or you are actually treating the underlying condition. And Laurie, maybe based on your research and lab research, would you like to talk a little bit about, attention and nicotine and what might happen?
Yeah, so I agree with what you said. The acute effects of nicotine is that it improves cognition and attention, and there's a high prevalence of smoking among people with ADHD, usually undiagnosed adult ADHD. But yes, exactly. So when you're in withdrawal, though, then it becomes the opposite, like all withdrawal. So you lose your ability to concentrate and to think.
So Catherine, thank you for that nice comment, but I think we're getting close to the end. So we welcome your comments. We welcome you using these resources. If you notice any errors, please email back to us. Anything you may have seen, there are some typos that I already saw myself, but we will fix those. But will the resources be translated into French? Carolina, can you comment on that?
I believe the resources will be translated into French as well.
I think we don't necessarily say dual use is more harmful, but we do say switch completely to vaping. So that implies dual use is not a good thing. Oh yeah, and there's a French resource. So thank you, Carolina, for providing that. Okay.
Okay,
well,
yeah. Thank you
have a great
so
weekend.
much. Yeah, thank you for joining us, Dr. Selby and Dr. Zawertailo, and everyone who attended the webinar as well today. Thank you. If anyone at this point needs to head out, that's okay. I'm just going to be making some more end of presentation reminders. But yes, thank you so much. And thank you for the presentation, both of you.
Thank you.
Thanks, everyone. Bye.
Thanks. Bye.
Bye. So this is just a reminder that if you would like to receive a letter of completion for this webinar, just to complete the post-learning assessment and evaluation, which will be sent to you all by end of day today, and you will have a week to do so. So the deadline will just be next Friday, June 7th. And our next Teach Educational Rounds in June will be on June 26, 2024, and it will be on the effects of nicotine and cessation on sleep. So stay tuned for that. There will be some more registration info coming next week. And if you have missed, a portion of today's webinar or just want to review it again or any other Teach webinar, you can check out our archive list on our website. And that's it for today. Thank you everyone for joining. I hope you enjoy the rest of your day. Thanks.